Hello, my name is Sophia Wells, and I'm currently in nursing right now. So, for our module 5, we had to choose a vulnerable population and do like a brochure and pamphlet to explain different resources and different facts and information as to why they're vulnerable and different health aspects with the different problems related to this population. So I chose to do the psychiatric adolescent population with mental health. And so the reason why I chose this population is because during my clinical rotation in mental health and community, I got to go to the UC Linder Center in Mason, and we got to be on this adolescent unit with patients ranging from the age of 11 to 19. And so I thought this population was really interesting because not only that I got to sit down and really get to see with different therapy techniques and how it helps mend and heal these kids and learning about their mental illnesses, but I got to observe a lot and really get to listen in on what makes a certain kid them and their life in different aspects and events that have affected them. And so something interesting that I found when I was doing research for my pamphlet on this vulnerable population is, according to the World Health Organization, 1 in every 6 people in the age range for the adolescents, so that would be 11 to 19, are affected by mental illness. And so you think, that's kind of strange. The fact that it's so common, but there's such a huge stigma against it, there must be something as to why this is. And so when I was doing further research, I was learning about different aspects that might affect this. And so one of the things is probably lack of understanding or education, especially with different family members or whoever the child is surrounded by. And there is a lot that can come from this. And so when there's a lack of understanding on something, people can react out of fear or anger because they are afraid and they don't know anything about it. And when it's dealing with a child, a lot of times the parent, they're trying to do what's best for the child or what they think is right. And so even though mental illness shouldn't be something that people should be shamed for, it is. And so as a healthcare provider, one of my huge goals and things that I want to carry out for all my patients, especially in pediatrics, which I strive to be a pediatric nurse, is wanting to make sure that I have full ears listening to the patient and giving them my full undivided attention to know that I'm a safe person that they can come to and talk to, and that I don't want to put on judgments on them for choices that they've made, whether they've been good or bad, or different things of ways if they might have tried to hurt themselves, or different feelings or thoughts that they have about themselves. Because from firsthand experience, I know what it's like to suffer with a mental illness, and as many of the population, I didn't get diagnosed actually till later. And that was another thing I found out that was interesting, that the World Health Organization had talked about, is that with this population, since many of them are vulnerable due to the fact that they're in poverty, a lot of them do not have the financial or medical resources to get diagnosed or even help or medications to help manage with this. And so it's a really huge thing that I think we need to focus on as healthcare providers, is not only focusing on the physical complications a person may have with a disease, but also mentally and emotionally, and how does that work on their whole well-being. Because I feel like if patients are not balanced up here in their mindset, they can be off balance in all aspects of their lives, whether it's getting the right amount of sleep, exercising, doing well in school, trying to hold down a job, their personal relationships with others, and how they treat themselves. So I just thought it was a very interesting population to research, and I look forward to hearing about other people's responses and why they wanted to research other different vulnerable populations as well.